Hello, my name is Judy Pace, and I'm the wife of two-time breast cancer survivor, Ronnie Pace. And today I'd like to talk a little bit about my journey with him through this experience. When he told me that we needed to talk, my nerves immediately went on high alert. And then he explained that he was having a biopsy the next day because a lump had been discovered in his right breast. I immediately turned cold, head to toe. My heart dropped and had all the thoughts of, this can't be happening. How can I live without him? We went on to discuss the fact that often with men, it is not malignant, very few cases compared to women. So we discussed this. And with a week and a half to wait for the results of the biopsy, I had time to relax and begin to think that probably this was benign. When I got the phone call from Ronnie, as he was out of town, that he had just received the news that it was malignant, I switched gears, jumped on the bandwagon of we're going to do something about this right now, and encouraged him to go to MD Anderson. He was seen within 4 days. And of course, the diagnosis was male breast cancer. When he had the surgery, I had complete confidence in his surgeon. And by now, I just feel that everything is going to work out fine. So what I'm saying to you is, ladies, please encourage your husbands, your boyfriends, your fathers, any male figure in your life to be checked for male breast cancer. If caught early, results are wonderful. So please, my message to you is, this happens, though not as often as in women, but it should be part of your health routinely checked things to do with your doctor. So have that conversation with your significant other and then with your husband or significant other's doctor. Thank you.
Hi, I'm Dorothy Gibbons, and I am the CEO and co-founder of The Rose. And today we're here to talk about a very interesting topic, and that's male breast cancer. Yes, breast cancer happens in men. And with us to talk about this is Dr. Gabriel Hortobagyi, who is the professor of medicine, the Department of Breast Medical Oncology, Division of Cancer Medicine at the University of Texas MD Anderson Cancer Center. And Dr. Hortobagyi is a researcher, a physician, an oncologist. He is someone who is called upon in the world of breast cancer because he is so knowledgeable, and he has many, many patients that he's helped with at the Rose for sure. But to us, his most important title is that he was the physician who cared for one of our board members, Ronnie Pace, who is a two-time breast cancer survivor. And for Ronnie, becoming a male breast cancer survivor changed his life, and he's taken it on to make it his mission in life to be sure that men know that they can get breast cancer. So Ronnie, tell us what it was like to find out that you did have breast cancer. What brought you to that diagnosis?
Actually, my wife did. I, like a lot of men, I have a great wife who makes sure that we stay healthy in spite of ourselves. I'd had a cough for several months, chronic cough, and she kept encouraging me, I use that word nicely, to have this cough checked. And I went to a pulmonologist, and my lungs were fine. Turned out the cough had nothing to do with my lungs. It had to do with allergy. But during the course of the checkup, a small tumor was discovered on my right breast from a CT scan. I, like a lot of people even today, I was ambivalent to what that meant. And I said to the doctor, okay. He looked at me kind of puzzled and said, well, aren't you worried about it? I said, worried about what? He said, it could be malignant. So then I got worried. Never in my life had I heard breast cancer in men in the same sentence. I said, yes, I'm worried now. What can we do? So we can wait about 6 months, take a look at it, or we can have a biopsy. I said, we're not going to wait 6 months. And so I went home that night and researched male breast cancer. Come to find out, it's the real deal. And about a 1% chance of being diagnosed with breast cancer. And so I made the unfortunate decision not to say anything to anyone, because I felt like I was going to have a 99% chance of being released from this situation and not worry anybody. So I kept it to myself. So I was really surprised to go 2 weeks, convince myself I did not have male breast cancer, to find out that I did.
And so, Ronnie, when you say that you didn't tell anyone, you're talking about your wife, right? You didn't tell her that it might be breast cancer or that they were looking for a tumor or anything like that, right?
Worse than that, I didn't tell her I had a tumor.
Oh.
And not because I'm some male, macho, machismo kind of guy, but I felt like that, why should I worry somebody I love so much unnecessarily? The chances of 1% seemed so foreign to me to be diagnosed with breast cancer. I felt like we'd have a good laugh a couple of weeks down the road and say, by the way, I had a tumor and it's benign. So, and I've said this to you in other meetings that we've had and other people I've talked to, is that please don't make that decision I did. It's a horrible thing to keep something from your partner that is this potentially serious. It denied me the opportunity to have my wife support me and my concerns, little that I had, but denied her the chance to be my support person. So I hurt her worse by not telling her than if I had told her.
Right, right. And Dr. Hortobagyi, this is not unusual for men to not share it or even to admit that they have it. How do you have, what is the most usual thing that men say when you're starting to treat them?
Well, first of all, this is a pretty classical story. The most common sign that leads to the diagnosis of male breast cancer is a lump. And of course, we get lots of lumps for a variety of reasons. And because men don't think they have a breast, they don't think that they can have breast cancer. So when they find a lump, either by examining themselves in the shower or because they have an incidental finding on an X-ray, they don't give it much thought. And as a result of that, male breast cancer is usually diagnosed at a higher stage, at a more advanced stage than breast cancer in women. Mr. Pace was fortunate enough that not only was this an incidental finding without him knowing about it, but it was diagnosed at an early stage because of the CAT scan. So that was very fortunate for him, and it led to the very good prognosis he has, and the fact that 8 years later he's doing extremely well. So part of the male psyche, if you wish, and I'm not a psychologist, is to take care of problems, and we take care of those problems, keeping them inside, and we just go at them and take care of them and move on. So it is fairly typical for patients with male breast cancer to keep it in until either someone else spills the beans or until it becomes obvious that some help is needed. But it is really important for men, as for women, to access all the support systems they have, because this is not only about the patient, it's not only about me as a person, it's about everybody who surrounds me, the entire family, because the ripple effect of a diagnosis like this affects everybody in the family. So eventually Mr. Pace did have the conversation with his wife, and I think he benefited enormously from her support and by having that conversation and that ongoing support. So this is really important.
So thank you. Thank you. That is so true. And I know we're going to hear from Judy in a little bit about how she reacted when she did find out that Ronnie had breast cancer. So Ronnie, talk to us a little bit about your treatment. I know you had a mammogram and just like a woman and all of those kind of things, but tell us what it was like to go through the process of being diagnosed and what your treatment was like.
Thank you, Dorothy. Part of my mission is, as we talked earlier about, was to educate people not only on male breast cancer awareness, but what the steps would be when you find out you do have a malignancy. Because I had no frame of reference of what to expect. The biopsy was pretty straightforward. I knew that was coming. And a sonogram, we had those. When they said mammogram, I about, fell over. I said, men can't get mammograms. So yes, they can. And so when I talked to women's groups with my story, I said, ladies, I feel your pain. I know what it's like. I walked into the room. I said, hey, get this little bitty breast in that big old machine. They said, trust us, we can do it. And they did. And so part of what I'm trying to do with this today and going forward is to help men understand it's okay. Mammograms are no big deal. It's just part of the process. It keeps you alive.
And what was your treatment like? Just the same as a woman's, or?
From what I understand, the treatment plans are pretty much the same. You diagnose the tumor, you take DNA, and you decide the treatment plan. I had a great care team at MD Anderson. Dr. Hortobagyi was steering the plan. And in my case, it was a typical deal. I'd had an OncoDX test, and I had 11 score, which gave me about 8% chance of a recurrence. And so we went with no radiation therapy, and we had oral chemotherapy after my mastectomy. And a mastectomy for a man is not nearly as traumatizing, I think, as for a woman. I can't speak for women. I just have talked to women, and some of them, it's pretty traumatic. But for a man, get over it. It's not that big a deal. So if you have to have a mastectomy, just get it on with and go down the road. But after mastectomy, it healed up, and we did the oral chemotherapy tamoxifen for about 2.5 years. And then we realized at a video I was doing for a group out of New York, I took my shirt off for the camera. I have found a tumor again in my right breast again, where breast used to be. And I was just stunned. I had it once, and I got it twice. Come on, this can't be happening. So 2 days later, back at MD Anderson for a biopsy, and sure enough, it was malignant. I mean, I was just at this point, I was just speechless. How could I be that lucky to get two? Went back to Dr. Hortobagyi. We realized that it was just the way it is. So we just, decided to have another round of surgeries. And this time we decided to have 33 days of radiation therapy and change the oral chemotherapy to an aromatase inhibitor. But from what I know, I think my treatment plan pretty much parallels that of a woman. Is that right, Dr. Hortobagyi?
That is correct. So because male breast cancer is relatively uncommon, for every 100 women with breast cancer, there's one or perhaps two men with breast cancer. Much of the information we have and much of the policies we have about male breast cancer are by extrapolation from what we have learned about breast cancer in women. It takes hundreds, sometimes thousands of patients to define what is the best treatment or what is the best way to make a diagnosis. And we don't have that luxury with men because of the small numbers. So much of what we do is based on what we learned in female breast cancer. So we treat male breast cancer with surgery. because the breast is so small, breast conserving surgery is seldom the option. So most of the times it's a mastectomy. For women, of course, the preferred treatment today is breast conserving surgery, but there's more tissue to deal with and to allow that to happen. In the case of Mr. Pace, since the tumor was so small, and he had a mastectomy, there was no reason at that first or initial diagnosis to do radiation or much else. But he won the lottery and he got the second breast cancer. So we had to go back and remove that too, and then redesign his plan. So we have learned there's a major project today that one of my colleagues is chairing. It's an international project that collects breast cancer cases from males. And we are trying to develop on the basis of this large international collaboration as much as we can get in terms of the genetics, in terms of the genomics, in terms of all of the subtypes of male breast cancer, so that we can then base future decisions on that new and more modern database. So things are happening, and things are happening in the right direction. And the successors of Mr. Pace will have perhaps a more male breast cancer based treatment than he did, even though he got what was the state of the art treatment at the time.
Mm-hmm. So that's so important. It sounds like it ought to all be the same, but it's not. And you touched upon this a little bit, Ronnie, and so did you, Dr. Hortobagyi, about the emotional impact on a man. And Ronnie, I know you said that you went to the internet and you found out about breast cancer, but there weren't many places to go for emotional help. Is that true?
Yes, and that's one of the reasons why I'm trying to keep this mission going, is that I've given this presentation for the last 8.5 years to anybody who would listen to me, groups as small as 2, as high as 500. Sadly, maybe of the group of 500, we had maybe 5 men. Men just don't want to listen to the possibility of getting it. So it's up to the wives and girlfriends and partners to go back to their male counterpart and say, hey, guess what I heard today? Men can get breast cancer. The component I never talked about in all these years, it talked about the emotional impact on me personally in my life. Part of which I believe, in my era growing up, boys were told to tough it up. You don't cry. You fall down the playground, you're told to get up, shake it off. So as we grew up into men, we repressed our feelings for so long, we forgot we had feelings. Mm-hmm. Secondly, they've been repressed so long, we don't know how to access them anymore. I personally believe women and men have the same amount of feelings. We just don't know how to get a hold of them, and we ignore them when we do. That's how we were trained. But I'll tell you right now, the diagnosis of male breast cancer will change your whole attitude.
You referred to access to information, and I think that's an enormously important aspect of this. So I think we have made a lot of progress in diagnosing and managing breast cancer. But part of the reason women with breast cancer are doing much, much better than 30, 40 years ago is because we talk about it. You can't open a magazine, especially magazines that focus on women's interests, without finding an article about breast cancer. It used to be that way. Breast cancer used to be a taboo. Nobody talked about it. It was a secret. And it was when it came out in the open and women were allowed to, not only allowed, but encouraged to talk about it, that things started to improve, because they sought earlier diagnosis, they sought earlier and better treatment, and that led to improved outcomes. There's no such thing in the male world If you open a magazine about sports or about mechanics or about other things that men might be interested in, there's not a single mention about breast cancer. So this is really an important aspect that is missing. And perhaps Mr. Pace and Ms. Gibbons can talk a little bit about where to access accurate, precise information about male breast cancer.
That is so true, Dr. Hortobagyi. And, you know, we are building resources for women and men to access so that they can learn more. Again, thank you so much for bringing us this information, for talking so openly, Ronnie, about your diagnosis, and Dr. Hortobagyi for giving us that insight on how this is truly a family and an emotional time for a man that we all need to be aware of. Well, thank you again, Ronnie and Dr. Hortobagyi, and of course, Judy, for sharing that important message to women, particularly about encouraging their men to at least check themselves. So that's one of the questions we always get. What kind of symptoms do men have? And I know that we're getting several things coming across our live chat right now, and I encourage anyone in the audience to send us questions. But that's the first one that comes up. What are the most common signs and symptoms of breast cancer in men? And I'm going to let Doctor, would you mind answering that for us?
So as we discussed earlier, the most common one is a lump in the breast, and that is usually not symptomatic. It doesn't really hurt, and most of the times it is found because someone palpates his own breast in the shower or getting dressed or undressed or something like that. Symptoms that can associate with this include pain, include the lumps under the arm or in the neck, and pain elsewhere or shortness of breath or something like that. But those are symptoms of a more advanced stage, and they usually suggest that the disease has spread. So ideally, breast cancer in men should be diagnosed at the earliest possible stage. So please don't overlook a small lump under the nipple or the areola or in the general area of the breast. It's better to raise a false alarm than to let it slide and come back weeks or months later with something much more severe.
Thank you. So some of the other questions I'm seeing have to do with what is the treatment process like for a man? I know you spoke a little bit about that. Both of you have some, but I think what the question's asking is, do men actually go through chemotherapy and have side effects? You know, what's a mastectomy like for a man? Who wants to answer that one?
Well, let me get started, and then perhaps Mr. Pace can add his own experience, because it's really important. So for really early stages of breast cancer, surgery comes first. And we normally do some ultrasound, mammogram, some imaging, a few blood tests, just to make sure that the disease has not spread elsewhere. And if it has not spread, then we do some tests on the tumor to know what type of breast cancer it is. And then we remove it surgically. Most of the times, as was discussed earlier, that requires a mastectomy. Sometimes it can be done with breast conserving surgery. We usually take a look at the lymph nodes under the arm. It's a small operation to determine whether it has spread to those lymph nodes or not. And depending on how extensive it was, radiation therapy may be suggested. Often in the case of mastectomy, it is not. If it is of a certain type, like triple-negative breast cancer or HER2-positive breast cancer, then chemotherapy is usually indicated in association with other treatments. If it is hormonally sensitive, Then sometimes it requires endocrine or hormonal therapy alone. Sometimes we recommend both chemotherapy and hormone therapy. We have increasingly precise ways to determine whether an individual patient would benefit from and would require chemotherapy or not. In the past, it was much less accurate, and we would recommend chemotherapy to many more men and many more women with breast cancer. But we have been able to step back from that and determine what is the best sequence of treatments for individual patients today. Maybe Mr. Pace can share his experience about how he went through this sequence and what the discussion was.
Thank you, Dr. Hortobagyi, Dorothy. Part of the issue is the fear of the unknown. Having no one to talk to, another guy that had been there before you, makes it kind of tough to be the pioneer in this stuff. But, I didn't have a lot of choices. The mastectomy itself was really not as big a deal as I expected. The recovery was pretty straightforward. The funny thing was the oral chemotherapy. One of the things I told Dorothy was when I first met my interview for the Rose board was I'm sitting there having hot flashes, mood swings, weight gain, hair loss. I said, I know what it feels like to go through menopause. And that's what it's like for a man. It's no different than for women. We're hormonal by nature, and that's what it does to you. But it's okay. The alternative is, I don't complain about anything. I'm just happy to be here, talk to everybody, and say, just go do
it. So you learn not to complain about anything, right? That's a good line. And yes, I remember, Ronnie, you going through the hot flashes, and that just was a good reminder for me that men do have some of the same reactions as women do to the treatment, and sometimes it lasts for a while. So let's see. I'm going to let you take this one, Dr. Hortobagyi. It's explain how genetics play a role in male breast cancer.
That's a very important question. It's a rapidly evolving area. So if you look at the breast cancer in women, between 5 and 10% are related to inheriting a genetic predisposition because of the existence of mutations, abnormalities in our genes. And that increases your risk of breast cancer manyfold. In male breast cancer, that's even more frequent. So today, one of the tests that we automatically do when we diagnose breast cancer in males is to look for mutations in several genes. The most commonly tested are the BRCA1 or NBRCA2, but today we do panels that are broader and test another 4, 5, 6 genes, which also increase the predisposition or the risk for developing breast cancer. Knowing the answer to that is very important because, number one, it increases the risk for that person, for that man, to develop a second or even third breast cancer either in the other side or in the remaining breast tissue should there have been a breast conserving treatment. Second, it has implications for the blood relatives of that person because they may be carriers of the same or similar mutations, and that would increase their risk of developing breast cancer. Third, we have now at least 2 new drugs that were specifically designed for patients who have mutations in these genes. And those are very highly targeted drugs. And they have just been approved very recently within the past year or so. And they are utilized for the management of both early and metastatic breast cancer. So it is really important to go through this. But to go through this, it is important to have a conversation with a genetic counselor because both normal and abnormal results have implications, emotional implications, financial implications, potentially employment implications, and of course implications for treatment for the person who's undergoing the test and for the rest of the family. And there are confidentiality issues. So it's a little bit complicated, and it's important to have an in-depth conversation with an expert about that. The test itself is done very easily on a blood test, sometimes on saliva or something like that. But most of the time, it's done on a blood sample, so it doesn't require a biopsy or anything of that sort.
Thank you. What is the likelihood of a man getting breast cancer? And Dr. Hortobagyi, if you'd also speak to the mortality rate of men with breast cancer.
So for every 100 women who develop breast cancer, there are about 1 to 3 men who develop breast cancer. So today, the rule of thumb is that in the US, 1 in 8 women develops breast cancer if they live up to the age of 80 or so. So you can divide that by 50 or so, and that would give you the risk of developing breast cancer. It is less than 1%, but it's still considerable. Now, if you are a carrier of one of these mutated genes, then your risk is much higher. Also, and I should have mentioned this earlier, if you are a carrier of one of these genetic mutations, you also have a higher than average risk for developing prostate cancer, cancer of the pancreas, and of course, breast cancer. So it is important to be aware of these mutations because they have broad implications about your health.
Let's see. In the absence of a mammogram and other diagnostic tools, are lumps easier to find for a man based on the less dense and smaller breast? Doctor?
You are way ahead of us. So that's an excellent question. And of course, you are well informed about dense breast being a risk factor for developing breast cancer in women. The knowledge base for breast density in men is much, much weaker. We have not come to the same conclusions. We have not had a sufficient study of the various levels of density in male breast on mammograms. I would imagine the result would be similar, but I have absolutely no evidence on which to base that answer. So I think it's a very good question. And as our imaging methods continue to improve, perhaps we will be able to answer this. And as our international effort to gather large numbers of patients with breast cancer progresses, maybe we will be able to get at least a preliminary answer to that.
Goodness. Let's see. Where can men access resources specifically for male breast cancer? And is there a reliable medical resource? Now, I'm going to talk about a little bit about what the Rose has to offer. And we are developing with a lot of help some very specific information for men. But I also want to offer that if you have a specific question, or if you'd like to talk to Ronnie one-on-one, or if you'd like to have him do a presentation, then I encourage you to send a note to info@the-Rose, and we will get that to him. And Ronnie, I'm assuming you're still okay with doing your presentations, right?
Of course.
Good.
I want to add one thing, Dorothy, if I could.
Okay.
For the body. In case those who have inquiring minds were wondering, I was negative for both mutated genes, so I had the good news of that as well. And secondly, the diagnosis and to treatment is important because I was initially at stage 0, and during my mastectomy, there was incidences a vascular channel movement, which bumped me to a stage 1. So I can't emphasize how fast you need to get this thing rolling once you discover something.
And doctor, I know there's many resources from MD Anderson Cancer Center, but like you said, there's still a lot to learn about male breast cancer. Is that true?
That is correct. And I think this is a very good opportunity to emphasize the point that most of us, at least living in North America, have the tremendous help of Dr. Google. But Dr. Google is a two-edged sword, and you have to be careful because Dr. Google can get you to very trustworthy sources and can get you to the fringes of craziness. So you need to make sure you are in the right place. So starting with creditable institutions like the Rose, like MD Anderson, some of the comprehensive NCI, National Cancer Institute supportive cancer centers is important. Perhaps one of the better places is to get to the National Cancer Institute database too. You can Google that and you can look for male breast cancer, but make sure that you are in the NIH NCI website. You can also look for the American Society of Clinical Oncology or some of the breast cancer foundations that have been discussed earlier. Breastcancer.org, for instance, has an extensive presentation, the Komen Foundation. So you have multiple resources. None of them is ideal. None of them offers all the information you might want to hear, but these are creditable, respectable sites. And make sure that you don't go bunny trailing in some dangerous place that will give you misinformation, because there are many of those.
So we want to emphasize that your care team, your physician, where you go really does matter, and it makes a difference. Don't be afraid to ask your care team about anything. But now, doctor, are there any clinical trials going on right now, or anything that I know you mentioned some a few minutes ago, but that could, provide a lot more information on male breast cancer?
Well, that's important. So first of all, I am not aware of any prospective clinical trials that are specifically recruiting male breast cancer patients. Having said that, one of the important changes that has occurred over the past 10, 15 years is that men are not intentionally excluded from clinical trials, and that many of the clinical trials for new drug development or new treatment assessment or new diagnostics that are developed to test it in breast cancer in general include both men and women with breast cancer. And that's very important because that's the way to learn. We mentioned earlier that there is this international effort to collect breast cancer samples, to look at the genetics and the biochemistry and the biology of all of these male breast tumors. Part of the long-term plan of that is to develop clinical trials for male breast cancer. There is one that has reached a fairly advanced stage. I am not completely sure whether it is open yet, but it is looking at inhibitors of the androgen receptor. Androgens are male hormones, and we think that they are involved in some way in the development and growth of male breast cancer. So there are specific drugs that are also being used in patients with prostate cancer, where there are similarities, that are being tested in male breast cancer. And so you might want to ask your care team whether their institution offers participation in the clinical trial or not, whether it is specifically for male breast cancer or just for breast cancer of the type you have. So that would be a good first step. There is also the opportunity of going back to the National Cancer Institute website. There's something called clinicaltrials.gov that lists all of the clinical trials ongoing in North America and many outside of North America in the Western world. And you can peruse that. You might be able to find some that are specifically of utility or might be of interest for your type of breast cancer. Again, if you do that in association with your physicians, that might facilitate the searching through that maze.
So we had a question about, is male breast cancer introductal? There are different kinds of cancers, breast cancers. So I know that may get a little too deep, but doctor, is it primarily introductal or is it invasive or?
Okay, so the word ductal means that the major channels that your body has to conduct milk that is produced by the breast. That's the major function of the breast. That's where most of the breast cancers develop, in the lining of those channels or tubes or ducts. Sometimes the cancer cells cannot break through the wall of those ducts, and then that is called intraductal, although I prefer the term non-invasive breast cancer. The great majority of male breast cancers is invasive. There are a few that are non-invasive. We seldom, if ever, become aware of those because they tend not to form a lump, and therefore the man with a non-invasive breast cancer may live the rest of his natural life without ever knowing about it. The non-invasive breast cancers are a risk factor. They are not a real cancer. So, because they can't kill you, if they can't go through the wall of the duct, then they can't travel to other parts of your body. So we treat some of those that are high risk factors so that they do not convert years or sometimes decades later into invasive breast cancer. But that's not where the problem is. The problem is with invasive breast cancer, and that's what we're concerned about.
So again, to reemphasize, it's either you find a lump or it's an incidental finding, as in Ronnie had with it being on a CT scan. I think we have one or two more. Let's see if there's, So doctor, we're back to you. What size lump should give us concern?
So in a normal male breast, there shouldn't be any lumps. Now, most of us men are not that sensitive as to detect really very small tumors. But I would think if you find something that is bigger than the tip of this pen, I would bring it to the attention of my physician. It might be something that is not important, but normally men do not have lumps in their breasts, as opposed to women, especially younger women who may have what we call fibrocystic disease or benign breast disease, where lumps are frequent, especially with the menstrual cycles, lumps come and go. That doesn't happen in men. So if you have a lump or if you detect a lump in the breast of your loved one, it's time to act.
Oh, thank you for that.
There you go.
Oh, Judy, this is one for you. And how was it difficult to get your husband to go get checked? And how can I approach my husband? It sounds like could be something going on.
Well, I didn't encourage him to get checked for male breast cancer. As he explained, it was just found in the CT scan. I did have to push him to have those issues looked at, which ultimately the cough, which ultimately brought on this diagnosis. I would encourage all the women to not only encourage their male counterparts to get examined, but also to have anything checked out right away if it's found. Luckily, Ronnie did that. Just getting him going the first time was difficult, but we had a really good result.
Men just do not like to go to doctors.
You may, I might add that it might be good to give an example of something you've heard to encourage them to see a doctor and have something checked, as opposed to just being vague about, you need to do this.
Ah, good. That's good. Yes. And another part of that education that we just don't have enough of right now. So I think we're about to wind down, and I want to thank you again for our audience for joining us, for the great questions. And, you know, we've learned so much today, primarily that men get breast cancer. Treatments are very much the same, but you have to go and have that checked. And I just think, like Ronnie said, men don't think they have breast. So that's probably our biggest hurdle to get over. So Ronnie, Judy, Doctor, do you have anything else you want to leave our audience with?
Well, I would like to mention that while there is no screening for male breast cancer, like there is for female breast cancer, it is useful for men to get used to periodically or occasionally palpate their breast while in the shower, or the soap facilitates a better examination. And if there's a lump, react to that. Second, after being married for 45 years, I've learned that it's a good idea to listen to your wife.
Thank you.
The third part is that male breast cancer and female breast cancer are highly curable, especially if they're diagnosed early. So we have made a lot of progress in this group of diseases, and we do much better than patients who develop lung cancer or colon cancer or melanoma or some of the other somewhat harder to treat diseases. So treatments have evolved. Treatments are much better tolerated, so don't be afraid of disfiguring surgeries or chemotherapy that makes you sick forever or anything of that sort. And perhaps Mr. Pace can attest to that while everything has a price, this is a highly curable disease and treatments are largely well tolerated.
So Ronnie?
I'd like to piggyback on that as well. The thing I found out the last 8 years is that you have to maintain, I share this with other patients and caregivers that I talk to, the biggest thing for me is to maintain a positive mental attitude. Like Dr. Hortobagyi said, it's curable. It's not like it was years ago. But if you could keep a positive mental attitude for yourself, it helps people around you also maintain their positive mental attitude. So I think it's important that we remember that.
Very good point. Very good point. So I think that we are going to wind this down. Once again, I want to remind you that if you have questions, you can send them to info@therose.org, and that Ronnie is available to speak one-on-one or to groups. And this presentation will be posted on YouTube and on our website and Facebook. So again, thank you so much for all of this information today. It was a great session, and we so appreciate you, Dr. Hortobagyi, such firm and strong and candid information. And of course, Ronnie, for being so courageous to share your story, and Judy for keeping at him. So thank you so much. We appreciate you all.
Pleasure.
Thank you both. Bye-bye.